traditionally, in order to demonstrate a clinical benefit in prostate cancer, you had to demonstrate that patients lived longer as a result of treatment or lived better. And those endpoints for prostate cancer have been either overall survival or a skeletal-related event prevention as a demonstration that you're helping patients live better. The difficulty with those endpoints is that you have to wait a long time in order to see whether overall survival is being prolonged, and it's becoming increasingly difficult to distill whether the drug that you are testing is impacting survival, because now there are multiple therapies that the patient can receive after they're off of a given clinical trial that can prolong survival. So we need to develop earlier endpoints that are closely associated with overall survival and demonstrate that those endpoints can be used instead of overall survival. So rPFS, or radiographic progression-free survival, is based on a definition of progression that was standardized in a document called the Prostate Cancer Working Group 2 Consensus Criteria, in which a standardized definition that we ultimately validated was used as a uniform means of measuring when a patient was progressing on a clinical trial. That was embedded as a co-primary endpoint along with overall survival in a clinical trial involving abiraterone. That trial was known as Cougar 302. And in that study, radiographic progression-free survival was highly associated with overall survival. When the FDA approved abiraterone for this particular patient population that was studied in this trial, they specifically cited radiographic progression-free survival as one of the more important measures that led them to believe that patients were benefiting from treatment. And so we may be sort of setting the stage for establishing that there is an interim endpoint, an earlier endpoint other than overall survival, that can be used to get drugs approved in this disease because they're so well associated with a hard clinical endpoint like overall survival.